The first is Emily Dodd, and sorry, I can't remember who, typical, doing a session, and then there's India Tunnard doing a session. So how do you want to split it? Do you want half an hour each or 40-20?
Yeah, I think we were going to do 20 minutes of presentation, and then we've got sort of 5 to 10 minutes of questions. So
right, okay, we'll do it that way.
Yeah.
Yep. Okay.
Cool. Shall I start?
Yeah, far away.
I can't get my camera on, so you won't be able to see me, but I'm listening and watching.
Thank you.
Thank you.
Thank you for joining us. Right, I'm going to share my screen, and we've had a little bit of a practice, and it did work. So, a minute. Let me stop sharing a minute because I need to do something about the sound, because I'm going to show something. I want to make sure we can all hear it. So there we go. I've done that. Okay, well, thank you everybody for joining us today. So as Martin said, my name's Emily Dodd. I'm a Senior Research Fellow at the University of the West of England in Bristol. And I'm joined today by my colleague Margaret. And Margaret Tatham works at the Watchet and Quantocks Dementia Action Alliance. So Margaret, did you want to say hello?
Yes, hi. Sorry you can't see me, but I'm here. Definitely here.
Well, okay, so what we're going to talk about today is a project that we've worked on together, looking at dementia in West Somerset and Cornwall. As Margaret works in West Somerset, it will sort of talk about the sort of perspective of involving the public in engagement in research in West Somerset. So what I'm going to do today is just tell you a little bit about my project that I developed and how we embedded public involvement and engagement, hopefully across all stages within that project. And I did a research project, and then I did a number of engagement events. So we'll talk about the findings from that, and then sort of talk about what I plan to do next after this project. So first of all, I want to say a big shout out, thank you to all the collaborators and partners that worked with me on this project. And it wouldn't have been, hopefully, I think it was a success, as it would have been without the support of these key organisations. Spark Somerset is the umbrella voluntary sector organisation in Somerset that supports all the other voluntary sector services in our area. I must say that I live in Somerset, so even though I work in Bristol, I am a country bumpkin and I love it, and I love living in my rural community, and so I come from a lived experience of living in this rural area. And then also, as I say, we worked with Cornwall as well as Somerset. So these are the organisations that we worked with on this project. So probably because you have attended a webinar on rural and coastal special interest, you probably already know some of this information, but there's some key evidence here to suggest that we do need to start thinking about how people age in rural and coastal areas. From the Age UK project report around the over 65 population is projected to rise by around half in rural areas. So that will tip the balance over by increasing the proportion of older people relative to younger people in those areas. So we need to think about how we support people as they age in these areas. And then the World Health Organization report has recognised that we need to understand and address the inequalities experienced particularly of people living with dementia in these communities as well. So that's kind of a background, just a very quick background as to why I sort of took on this project. Also, I have a lived experience of living in a rural area, and I had family members living with dementia in rural and coastal areas. So it comes from both a practice and personal perspective. So really what I wanted to find out was the focus around sort of the role that the voluntary sector in particular have in these rural and coastal communities. So I wanted to find out what people are currently accessing, what support they might be missing, what difficulties people are facing in getting that support within these communities. And as I say, in particular, how does the voluntary sector support people living with dementia in rural and coastal communities? There we go. So first of all, I just want to say that with all the work that I do, I don't want to be sort of seen as what some people have termed a mosquito researcher, where researchers will fly into a community, extract information, and then leave, and the community never sees that researcher again. So that's not kind of the researcher I want to be. I want to be that researcher that works with communities to really involve them in hopefully research that matters to them, and maybe hopefully in future led by them as well. So key to this project was developing those initial relationships with voluntary organisations to support me with this project. So initially I had conversations with Cindy from Spark in Somerset, who put me on to Margaret and other Dementia Action Alliance supporters. And we really sort of started that partnership working very early, thinking about how we could work together to involve people in the project, and how we might sort of support people to engage with that project. So sort of handing out and sending out information sheets, where to hold interviews and focus groups with people, and who might be particularly interesting people to talk to as well. So Margaret, I didn't know if you wanted to sort of come in here and sort of give your perspective on this early collaboration that we sort of worked together here.
Well, I was really pleased when Emily approached us, because we have been involved with research before, but nothing seemed to come from it. We have, all of us, felt for a long time that we didn't know what was going on in research. One bit of research we had was research about research, and they were asking us why people didn't get involved in research, and we said because we didn't know that anything was going on. And Emily came along and was very clear about what she wanted to do, what she was trying to achieve, and was very keen to listen to us. And that's what we all felt was really good. And she's shown us that she's carried it through and come back. I mean, I think it's 2 years now that we've been going. Yeah. So that shows, you know, Emily's commitment to it and the fact that she really did listen to us. So thank you.
And yeah, I think I remember one of those initial conversations we had where we were looking at the information sheet I'd written, and I'd followed the guidance from the Deep around sort of how to write an information sheet. But you said something really useful, was to just put a little photo of yourself on it, because sometimes people just react differently to seeing who the person is. And I think that was a really useful piece of feedback for me. I hadn't thought about that before, and now I tell my PhD students, my master students, to do the same if they're happy to do that and feel comfortable to do that, because it just gives that sort of personal feel to them.
I think that's really important, that people see that they're dealing with a person. It's not just some far off thing.
Thank you.
I think involvement is so important, that once people get to, you know, Emily came and talked to us and people got to know her and trust her. And she also went through me. I think if she just approached groups without going through somebody like me, it wouldn't have worked. So I think that's important too.
Yeah, I think so. And I think you're right, that kind of feeling of developing that trust, you know, and coming and visiting you. You know, I think you're on the other side of Somerset to me. It takes me maybe almost 2 hours sometimes to get to you because of the roads, but it's worth it, because I feel like that's what I want. I want to be able to make those connections with people. So what did I do? So firstly, what I did was I spoke to people as we've been talking, and I spoke to 21 people in all, and I spoke to people living with dementia, their family carers, some paid staff in the voluntary sector, and also volunteers. And you can see from here where those participants came from. And as Margaret was saying, in some instances, I sort of went to the groups, I got involved with the singing group. I came to your birthday, your organisation's birthday celebrations, and I spoke to people there. And in Cornwall, that was really fun. I went with the Sensory Trust. We went to a walk, an outdoor walk, and we did a little focus group by the duck pond. So that was a lovely way in which I sort of got to experience what they do in their group, but also to hear about their experiences of accessing services. And so what I did with that information is I did some analysis of the transcripts from those interviews and focus groups. And I'm not going to really focus too much on the analysis of that today. But sort of the main overarching themes was around sort of connection and disconnection, and both the physical around the transport issues, sometimes feeling disconnected through transport troubles, and also that sort of at times ambivalence around digital connection, sort of recognizing sometimes it's useful, but other times it can be really problematic for people using digital connection. So what I did was I wanted to sort of find a way in which I can share my findings. So what I did was I made an animation of my findings, and so I'm now going to share the animation, and we'll talk afterwards about how Margaret and the team at DAA supported this work. So I'm going to show this and hope it works. It worked earlier. It's about 3 minutes long. The Rural and Coastal Dementia. Project. The aim of this project was to find out about people's experiences of living with dementia in rural and coastal communities. The following animation represents some of the issues that some people face. The characters are made up and not based on any one person. This is Brian. He's lived in a small village for many years. Everyone knows everyone in the village. His wife, Betty, sadly passed away a year ago. This is Paul, Brian and Betty's son. He lives in a town about 45 minutes drive away. Brian is living with dementia, and Paul is Brian's main carer. The GP gave Brian and Paul lots of information about where to find support for dementia. They both felt overwhelmed and not sure where to start. It was times like these they both missed Betty. They were not used to doing these sorts of things without her. Paul saw that his dad needed some help around the house. Paul rang a dementia advisor. She met with Brian and Paul. She helped them to make sense of the information and where they could get help. Many of the care providers were unable to help. They did not have enough staff to travel out to the village where Brian lived. A lot of information was online. Brian wasn't used to the internet, so Paul organised the support for Brian. This was time-consuming. Caring for his dad started impacting Paul's work. He was feeling quite alone in supporting his dad. Brian spent more time at home on his own since giving up driving. He was feeling less confident to go out in the village by himself. He worried he might bump into someone and wouldn't remember their name. He didn't want to tell people he had dementia. There was a group that helped people adjust to their diagnosis. This was held in a town too far away for Brian and Paul to get to, though. After more searching on the internet, Paul found a dementia group held in the town where he lived. Run by volunteers, the group met in a local cafe. Brian was unsure about attending the group. He hadn't really ever taken part in clubs and groups before. But getting to the group was difficult. No public transport stopped in the village. Community transport was only for medical appointments, and taxis were too expensive. So Paul drove the 90-minute round trip to take his dad to the group. A lady from the village who knew Brian and Betty well brought her husband to the group and so agreed to take Brian too. Paul could then return to work. In time, the group leader helped connect Brian to a men's shed and a gardening club and found a care group for Paul. Paul didn't feel so alone, and Brian enjoyed getting out with others. A reminder that the characters in this animation are made up and based on some of the experiences shared in the project. A big thank you to those who took part in the project. So that's sort of what I tried to do, sort of bring the findings from those interviews into that animation. And as I say, Margaret and the ladies from the Minehead Dementia Action Alliance helped sort of gives me some feedback on early drafts of the storyboard and on the animation itself. Did you want to come in, Margaret, with any thoughts on that?
I think I said to you that you needed to put something at the end, didn't I?
Yeah.
That I felt you needed to say. You stopped suddenly. I remember that you stopped suddenly where they had sorted everything out, and I felt it needed a bit more. And we came up with the idea of having the slide at the end about the thank you to everybody and everything. And everybody welcomed that. When we showed it to our group, Emily showed it to our group, they were absolutely thrilled to see it and that they'd contributed and felt it was so true. That was really the big thing.
Yeah. And I remember that the other Emily, she gave us some feedback on the car and the way that the car sort of whizzed off. At one point I had the car whizzing off. She felt that wasn't right. It needed to be different. And so I sort of made it fade rather than whiz off into a different direction. So yeah. Oh, Martin, did you want to come in?
Yeah, about the video. It's a very good video. How did people with dementia find having the music and the voiceover? Because I couldn't cope with that.
Oh, could you not? That's really useful for us to know. Margaret, I don't think anyone sort of picked
Nobody
that
commented on that, did they? No, nobody said that.
No, but that is useful. I think it might be that we need to maybe put the sound down a little bit on the music to make it easier to hear the voice. And also what I think is I need to put some captions on it as well, so that people can follow along reading it if that's the preferred way as well. So that's sort of other thoughts that I've had on how we can improve it. But thank you, Martin.
Yes, I think that's a good idea. I think of captions, I mean, some people can't hear very well. That's a thing that we're finding more and more as well. Yeah. So captions would help them, wouldn't it?
Yeah, definitely. Yeah, I do need to look at how I do that. I'm just dreading that bit of how to do that. Might need somebody that with the knowledge of the software to help me, I think, which we've got in our tech team. So
saying that, you've got a spelling mistake.
Oh, what?
You've got a spelling mistake.
A phone?
A spelling mistake.
Oh, have I? Oh no, have I?
Available.
Oh yeah. Thank you. I'll trying to remember that as well. Thank you.
Oh dear, I should have noticed that.
We've made it for about a year. It's been like that. Okay, thank you. Okay, so I'll move. Oh, somebody else wants to come in. I can see a hand up.
Yeah, my question is, what audience is this presentation aimed at?
I think for anybody really, anybody kind of wanting to have a bit of an understanding of what it might be like trying to navigate living with dementia in maybe a rural and coastal community and some of those challenges that people are experiencing. So it might be families, or it might be potentially healthcare professionals, other voluntary organisations.
Yes, I mean, I like the presentation. I like the way it's produced. It doesn't give any answers.
No. I think it's sort of that's maybe not where that was. It was sort of trying to pull my findings together of what people were telling me and trying to give a bit of hope with trying to finish the animation with a little bit of hope, and that eventually they managed to find workarounds to support Brian in his community. Martin?
I'd like to answer that question. People in towns don't realise the distances involved in countryside. You said it takes you 2 hours. I'm actually very surprised at that because I didn't think it was that big, to be honest. Well, it will take us 3 hours or 4 hours, but people in towns don't realise the distances involved. So it's more an information film. I think it's very good. Kind of up here, we call them toonsers, people that live in towns, and they need to realise the distances involved and the problems with transport. So yes, I can see it'd be very useful. Yeah.
I mean, here there are some buses, but they're not reliable, and they only go towards Taunton. There are some to Minehead, but you know, on the whole, things go to Taunton, to the main places. They don't go within the villages, so that if you're living here, if you're living in the next village, it's hopeless. Our car's broken down at the moment, so we are stuck.
Oh, yeah. So yeah, that just goes to show. I'm very conscious I haven't quite finished. So shall I sort of move? We're doing our Q&A as we go along, I feel. So that's fine. I'm quite happy with that. So but I'll move on to the sort of the next bit. So yeah, so as I say, what I didn't want to do was just leave my research there. So I factored in some engagement events. So what I did is I took my animation and talked more about the findings back to the community groups that spent their time with me, or I spent my time with them, to share the findings, but also to engage them in an exercise of trying to prioritise some of these findings. And I did that over 3 events. So in West Somerset, I with discussions with Margaret and with her counterpart Val in Minehead, we thought it would make most sense to do that via just coming back to those existing groups and speaking to people and using those existing groups. And then in Cornwall, I organised a separate event where people came, and that possibly might explain the lower numbers in Cornwall compared to Somerset. And so what I did was I used what's called the Diamond 9 priority exercise. So I identified 9 sort of themes that were coming out of the interviews. And I stuck them on these little cards. I put some questions on the cards that people could reflect upon. And then they got into small groups and they worked together to talk about the cards and to put them into this diamond shape. So what the top one being the one that they felt was the most important one that we should try and start to address through research. And yeah, so we did that. And then this was the sort of the main diamond that I don't know if that's easy to see or not, but there was 12 small groups across those 3 events that worked together. And this was, I collated all those 12 diamonds, and this was the sort of the main diamond that came out of my work, out of that engagement event. And I've just added some quotes to show that the top 3 that people felt we needed to do more research around, and to look at how we might be able to start improving things in this space, was around that diagnosis and post-diagnostic support. That feeling that people just feel quite abandoned at times and don't know where to go. The information and signposting, so that sort of thing with Brian, where everything was, they just got loads of information and they didn't really know where to start with it. And then this came up quite a lot, this idea of health and social care coordination, this feeling that there might be lots of people involved, but they don't know who to go to for what to support, but also that very often different sectors of health and social care, including voluntary sector, don't often sort of talk to one another, and how we might be able to improve that to improve the experience for people. And so reflections on the project and involving the public in the project is, again, I think this is sort of stuff that comes up time and time again, but that importance of having that time to invest in those partnerships that with Margaret and the team, and that we need to reimburse voluntary sector organisations appropriately when they do get involved in research. And managing communicate expectations early on. Margaret, did you want to come in on this one?
Yes, I think it was quite important that we knew what you were actually trying to do, and that you would stay with us. You know,
Yeah.
I think my initial thing was, oh, I'm worried that this is going to be, as I've said before, in and out. You know, what's it you called it, the mosquito? I think that's
Yeah.
brilliant metaphor. And you've stayed with us, which we all thought was so important and made us really want to trust you if you want to do anything else. So, you know.
Yeah. And I think that also came from, we had a conversation that you have been involved in other things. And like you said, you don't really know what's happened as a result of that. Whereas
that's right.
That feeling of trying to make sure that, you know, if this is a one-off thing or if this isn't something that you want to sort of continue, so that people know from the outset what to expect. I think that was what the conversation we had was. But it felt to me that the reflections are you know, within these communities, that the VCSE sector is very critical at supporting people living with dementia in rural and coastal communities, and very often it can be undervalued. I know we've had conversations about that in the past.
Well,
as well.
Here in Watchet, there are so many different voluntary groups doing so many different things. It's quite amazing, and it's often the same people involved in all of them.
Yeah, and that's it, isn't it? That core group of people.
Yeah.
And I think that came up in our conversations as well, that very often people feel like, and very often they're older people themselves, and they're worried about, you know, if something was to happen to me, how is this going to continue? I had one lady that drove for community transport, and she was 85, and she was, I can't do this forever. What about the other people I support? You know, so we had those conversations as well. So what's next? So I've been sharing widely different events and different conferences, and I've spoken to at the Somerset Dementia Pathway Review and given them some feedback on what's happening, to hopefully sort of feed into their review of the pathway in Somerset. And I've just been awarded some money to develop some of those priorities and research around those priorities. So me and Margaret will get to work a little bit more on these ideas as well. So I just wanted to leave with this picture of Margaret. And Margaret, did you want to talk about this as well?
Well, I felt it was given to me, but it was really for the group. And I did get the chap in the pullover next to me to come. Nobody else could come because it was in the evenings, because they're all getting older themselves. But I was very thrilled with this, and it's actually the second time we've had it. And my husband told me that we're actually the first group to have had it twice. I don't know how long it's been going on, but we were very pleased with that. And it's just for a group that is doing things in the community. So thank you for putting that there.
Okay.
I feel quite touched that you've put that there. Thank you.
No worries. Okay, so we've got our contact details there if you wish to get in contact with us. I'm going to stop sharing my screen now, and then got a couple of minutes, I think, Martin, for some any more Q&A.
I can't see the chat, so I don't know if anyone's put anything in the chat.
Yeah. Can I just say that I'm so glad that people have talked about how difficult it is to live in the rural and coastal areas. People see us as a lovely holiday place, which we are, but there's few jobs. It's not just the older people there's a problem for here, but I could go on about that forever. It's not just the older people. Problem for everybody, this being remote. It's lovely, but it has its problems.
Yeah, so in the chat, thank you. Ellie, I think, has given her reflections. And Emily has asked about how people can access the record. How can people access this recording and think about it themselves? So the film is, I believe, on the Spindy website now, but it's also on YouTube. So I can share the link. So if you share this, and I'm happy for my slides to be shared. So I can put the link in where the video is, and people can access it that way.
There's a race to get hands up. I think James came first.
Hi, James.
Hi. I'm speaking from the Highlands of Scotland, And you'll be glad to know that your problems are exactly the same as our problems up here. And I would certainly agree with you with the first three diamond priorities. I think that's exactly what we're experiencing up here in Scotland. So thank you very much indeed. Thank you.
Thank you. So yes, hopefully I will sort of try to, with Margaret and sort of co-produce some research now to try and focus on a project that we can work on to try and move things forward and improve things.
Can I ask where you come from, James?
Gairloch Head.
Right, because I live in Peterhead, so I just wondered, yeah. So we've got the problems. Ellie, you were next, I think.
Thanks, Martin. Yeah, just to say, I really enjoyed your presentation, Emily, and also to share that. So when Emily was conducting the research with the Sensory Trust, I was working at Sensory Trust at the time, so we were in touch about Emily coming to the groups. And I remember the day that you came to our Penzance session, and it was the Paul Nature Group, which is particularly rural. It's kind of on the tip of England, really, kind of, a few miles from Land's End. And I remember at the time the group was going through a bit of a change of, membership and things. And I just remember really feeling for you, Emily, that you'd come all this way and that only a few people were in the room. And then, we had like a community member and a carer, I think, and maybe one person with memory loss, I think, maybe not dementia. So I think just wanted to reflect on just Emily's kind of empathy around that situation and how, but also the challenge for research is when, we have to plan these things in and try and pick the right moments. But then obviously there's so many factors that can influence who's in the room that day, especially when people are living those challenges. So I just wanted to share that because, on a good day when the sun's out and everybody's able to be there, for example, or you get these kind of moments when the whole group are there, which could be, 16, 20 people, but you also get moments when there's only a handful of people or think people's circumstances change. So I think it just to kind of bring that really from that perspective. And I think from the charity perspective that where I was working at the time at Sensory Trust, we felt that ebb and flow, but we really felt for Emily in the sense of that we wanted to have lots of people there for you. So I think there's kind of, trying to, just consider those challenges really when people are living them in the day to day. They're very real and and it's kind of, it's interesting, isn't it? Because that's what you're trying to gather is kind of these challenges, but it's an example of people, experiencing those challenges and people not getting picked up and everything you're speaking to about the woman you just mentioned who's in her 80s who does the community transport that Margaret was mentioning. We have stories like that. There's a volunteer Cornwall driving scheme in Cornwall and it's volunteer drivers that support people to get to different places. But often those people end up volunteering for us as well at Sensory Trust and then and becoming group members and becoming very embedded because they're looking for social connection as well. So I think I just wanted to mention that as well, that often there's that aspect that happens in the Cornwall groups. But thank you so much, Emily. And I think your animation is just really refreshing. I think it really sticks in my mind as, I think it's very accessible and people can maybe feel part of the research. And I think what Margaret was speaking to, it really moves away from that mosquito approach of research that people can see themselves in what you've and the outputs and they can give some feedback and it gives people moments to feel part of it and to feel a sense of achievement that they've helped you do that. So I think it's a really, really nice format. So thank you.
Thank you.
Has anyone else got any questions?
Can I just say that our community cars, we have managed to persuade them to bring people to the group, not just medical things. They said they couldn't bring them, it was medical. And I argued and said that it was a health thing and it was important. And we haven't got anybody at the moment being brought, but for a couple of years, we had 2 people being brought together. So that was really brilliant. So Amazing. It might be worth pushing that one.
Well done.
I had a question, and it's a very strange one. Were any of the people with dementia have a rare dementia?
There was someone with Lewy bodies and somebody with PCA.
Because I have PCA, and I have fantastic post-diagnostic support. I've got the best in the world.
Real. That's good.
Because I get a dementia nurse every 3 months for an hour and a half for a cup of tea. and to follow me around the houses into care and all sorts. And I get to see my neurologist every 6 months, only because of being nosy about my PCA.
Mhm.
That's one way of getting good diagnostic support. So that's all.
Thanks,
Oh,
Mark.
that's interesting. Yes, thank you.
I'm very conscious of the time.
Yeah. So yeah, are you ready, India?
I am, yeah.
Yeah. India's going to talk about deaths in rural communities, and I must admit, I'm on a PPI, so if she doesn't praise herself enough, I will. Thanks.
Thank you, Martin. That's very kind. And apologies, Martin, because a lot of this you already know. So thank you, everyone. The title of my presentation is Exploring Geographical Variation and Where Older People with Dementia Die. I'm going to largely present. I'm a PhD student at the Cicely Saunders Institute at King's. So I'm largely going to present about my PhD and the public involvement work that I've done within my PhD. So Emily's kind of touched on some of the things I'm going to touch on here, but just to give you a bit of a background, what we currently know is that where people with dementia die is an important indicator of care at the end of life. And in England, much of the older population live and die in rural and coastal areas. So the graph on the right-hand side is quite nicely indicates by the red patches the increased proportion of those populations that are aged over 65. We also know that people in rural areas often face limited access to hospital and other specialist services. And I've put in coastal ? In there because we wonder if also this occurs in coastal areas and particularly those rural coastal areas. And as we're all aware, dementia is increasing and often people with dementia face unequal access to care at the end of life. And there's increased prevalence of dementia in these coastal populations. And again, the graph on the right in the green kind of indicates the higher prevalence areas pretty much situated all around the coast. So my PhD began with a kind of review of the international evidence to understand where older people with dementia, as compared to older people with cancer, die in rural, coastal and urban areas, and to see if there were any factors associated with place of death by location or condition. We included 29 studies, and the studies broadly said that rural residents were more likely to die at home, urban residents were more likely to die at hospital, and this was the same for dementia and cancer. We found no examination of the coastal context, and while we were able to include 2 studies in coastal areas, they didn't think about the impact the coast had or living in a coastal area had on their findings. And as you might expect, most of the studies took place in cancer populations, and about half were half as many in dementia. But you can see the full paper using that QR code there if you're interested. But this really formed like the foundation of my overall PhD. So we decided to focus on examining and comparing where older people with dementia died in coastal, rural and urban areas of England and factors associated there. So we began this by looking at death registration data of all the deaths in England from 2014 to 2023. And then this is going to be supplemented by qualitative interviews. So just to talk firstly about that first study, that is a population-based cross-sectional study with an aim to describe and compare the place of death for people living with dementia in coastal, rural and urban areas of England specifically. We used death registration data from 2014 to 2023, and deaths were included if the decedent was aged 65 years and over at the time of death, if the place of death and location of usual residence were listed on the certificate, and if dementia was listed anywhere on the death certificate. We coded deaths as rural if the place where the person lived had fewer than 10,000 residents, and that's aligned to ONS classifications. And we defined, or we coded deaths as coastal if the area in which the person lived was within 500 metres of the coastline. And this is aligned to the Chief Medical Officer's report in 2021, looking at health in coastal communities. We described the data and ran a multinomial logistic regression that was clustered at the local authority level. This might mean nothing to some people, so don't worry about that too much. So just to kind of give you an overall description of these studies, we included just over 870,000 deaths. Around 20% occurred in a rural area and around 10% in a coastal area. As you can see by the top bar, the majority of deaths occurred in a care home, and as you might expect, fewest in hospice. But then looking kind of across these geographical areas, we can really see that there looks to be increased proportions of people dying at home in rural areas. And perhaps more interestingly and less easy to explain are that there's an increase in care home deaths in urban coastal areas from what it looks like. So the next part of the analysis was to run this regression model. And basically the regression model allows you to adjust for other characteristics to see if there really is this kind of true association between place of death and where someone lives. So we adjusted the model for age, sex, marital status, country of birth, number of contributing conditions listed on the death certificate, the year the death was registered, the area level deprivation, the number of care homes within the local authority, and the distance to nearest hospital and hospice. And we found that there is a true association between living rurally and home deaths. And that this actually increases a little bit more if you add in the kind of coastal factor. We also found that compared to inland residents, people in urban coastal areas are more likely to die in a care home. And this remains even when you adjust for the number of care home beds within the local area, which is still puzzling me and I'm still thinking about. So in this study, we concluded that there's an association between rural living and dying at home for people with dementia, both inland and coastally. But we really want to drive in the message that deaths at home, we're not saying that this is necessarily a good thing. It doesn't tell us that it was aligned with the person's wishes or indicative that they had a good death. It is just an association. We also feel like there's a need for further explanation of preferences and the availability, accessibility and quality of services to support people with dementia to die at home. And as I said, the death certificate data kind of gives us this full picture of all deaths in England, but it doesn't give us really the contextual depth that we were looking for. So we don't know anything around healthcare use, for example, because the data sets that report that don't reach out into those more rural areas. But we really feel that, like, as data sources expand, researchers should look into doing that into the future to see if healthcare use can really does impact on where people die, particularly in these rural and coastal areas. So as I've just said, we don't know anything about preferences. We don't know anything about health and social care use, and nor do we know anything about local support and how these things might impact on where people with dementia are able to die in rural and coastal areas. So this led me on to my qualitative interview study, which I'm currently undertaking. And the aim of it is to explore carers' perceptions of what influenced where people with dementia died. And we've really drilled down to coastal areas because this is really where the research is lacking. So my sample will be bereaved carers of people with dementia. The person with dementia had to have lived in a coastal area and have died more than 3 months, but less than 3 years prior to the interview. This is where where I've advertised the study so far. And in the interviews, we will talk about preferences, illness factors such as dementia severity or coexisting conditions, support, whether that be professional health and social care support or from informal carers, access and the use of services within their area and the quality of these services. So I've included this recruitment flow diagram just to not really tell you much other than to tell you that so far we've had 12 people complete the screening form and 4 people, I've just had my 5th one, be recruited to an interview. So it's happening. It's just perhaps a bit slower than I had hoped. So with that being said, if you know anyone who might be interested in taking part in this study, please do contact me or feel free to pass my details on. And then I wanted to reflect on the public involvement work that I've done within my PhD so far. So it all began with my NIHR pre-doc fellowship. I had a public involvement group for that project, and I used kind of the final meeting with them to really develop the ideas for my PhD proposal. In 2024, we were then given some funding by the King's Engaged Researcher Network to hold a series of public involvement workshops, which Martin was involved in and has been continued to be involved in, which is great. So in that first meeting with them, I gave them an overview of my PhD plan that we discussed and some of my systematic review findings. We then met again in the June and reviewed the findings, discussed this coastal definition and the topics to be included within the interview. And then in September, I presented some of the quantitative findings and discussed where I might recruit from for my interview. We then ran out of money and had to apply for some more money from the faculty that I work with in. And so again, at the start of this year, started another series of workshops where I'm able to present my findings and discuss recruitment again. They reviewed and we tested my interview topic guide prior to starting the interviews. And we've got another workshop tomorrow where I'm going to reflect on their work with me during this time. So this slide again is really busy, but actually it's what I will share with the group tomorrow to really reflect on their suggestions for the work and how this has impacted the work or where it hasn't. I've used one of these kind of, you said, we did kind of frameworks before to try and make sure there is that feedback loop. I think Emily was touching on this, you've got to, make sure you're feeding back to these patient and public involvement members to ensure that they do feel like the things that they're suggesting to you or the work that they're doing with you is really having an effect, or that you are really hearing them. So that's what I hope to do with one of these frameworks, and we will discuss that a bit more tomorrow. So I also wanted to reflect on some of the benefits and challenges of public involvement. Obviously, there's so many benefits, but predominantly around ensuring that the work is relevant and really aligned to real-world experiences. And public involvement members can also support us to think about the real-world application of our findings and support the sharing of those findings. But I also wanted to reflect on the challenges of involving public members, particularly when you're not able to make all the suggestions that are provided by members. And I've actually found that using the framework that I showed before has actually been really helpful in reflecting back to public involvement members what I've not included and why I haven't, and those conversations actually really build those relationships in a more trusting way. It's also really hard to involve members of the public in big data studies, typically because they involve highly confidential and detailed databases that can't be shared. And the analysis is often very complex and difficult to communicate. But it's something that I've found that through developing research questions with them and identifying key factors and sharing results early, you can actually involve public members very meaningfully in this kind of work. I also wanted to reflect on working particularly with rural residents, because we've found that typically it has meant that we're limited to online meetings. purely because everybody is all over the country and it's hard to find this kind of most efficient way of meeting in person, and we're yet to really nail that down within these workshops. There's also issues sometimes around connection and those sorts of things. But overall, I think you can probably see that I feel that the benefits far outweigh the challenges, and actually the public involvement work I've done in my PhD has actually been one of the most enjoyable parts of my PhD, and I really loved it. So my next steps are to work with public involvement members to support the analysis of my qualitative interviews, and to work with them to aid the interpretation of the findings, as well as integrating the findings with my earlier quantitative findings. I also want to work with them to develop a lay language summary that I can share more broadly, summarising my whole PhD. However, this is subject to funding, so we'll see if that really is able to pan out. But we are also working on a publication that is reflecting on public involvement support in doctoral research, and it's building on a paper that we wrote a couple of years ago, looking at public involvement supporting doctoral research, but within a large dementia care programme. So it's building on that paper. Thank you for listening. If you'd like to get in touch, that's my email and a QR code to my LinkedIn. So thank you. Stop sharing so I can see you all.
I can't see if there's any chat, or has anyone got questions? Andrew, sorry, Margaret.
Margaret, yeah.
Yeah, that's absolutely fascinating. Thank you very much. I was just thinking about the people who had left our group and where they went. Some of them went to stay with families. Some moved a long way away to go with families.
Yeah.
Quite a few. The others have usually had a balance between being in a care home and being in hospital. And, you know, because of the situation, quite often they went to the care home because they had some physical problems as well as the dementia, and the people at home couldn't help, couldn't cope, obviously. But they were in and out, going between the care home and the hospital, and I don't actually know where they died, but they weren't at home. I don't think any of them have died at home.
Interesting.
From what I know. But there hasn't been anybody recently. The most recent ones were people who left us. They left us because they went they left us to go and stay with family, and that was what happened. So I don't know.
Yeah, which is interesting, because I will miss that group if they went to somewhere more inland. I'm going to miss that group, and it's a limitation of the study, but that's an interest of mine that I need to think about a bit more, I think, and think about future looking at that group.
Yeah, I've no idea of the geography.
No. Thank you, Margaret. Just having a look at the chat. And Georgina, that's the data set that I used to classify my deaths in my quant study. So thank you. It's a great data set. Margaret, do you want to do something else?
Yeah, sorry, I should have said it before. Something that my husband was actually listening to it with me, and we were thinking about. There are a lot of care homes in this part of the world, in West Somerset. There are. Now, are they there because there's more people? Are there more people here because there are the care homes? I expect it's to do with the availability of ex-hotels that have stopped, and they've been taken over by care homes. But I think there is that element of where there are places for people to go, which there might not be if you're rural. I mean, we are rural and coastal, so we cover everything.
It's an interesting point about the hotels thing, though. I'm from Torbay, and that's kind of where my interest in this stemmed from. But it's the same situation. A lot of ex-hotels turning into care homes. And yes, is it chicken or the egg? But yeah, thank you. Emily.
India, I was going to ask you about in your interviews, are you asking about people's advanced care plans? I may have missed it if you'd already said that. Is that something that you're asking about?
I'm asking about preferences and if the preferences were discussed, not directly advanced care planning.
Right.
And that is purely because when with the first PPI session I ran about my proposal, I said to the group, there was one person with dementia and the rest were carers, and 3 of them were current carers and 2 bereaved. But I said, have you thought about advanced care planning? And they all laughed me out the room and said, we're managing today, we can't think about the future. So that really steered me away from thinking about advanced care planning. But I thought the preference question, and if conversations about preferences had occurred, advanced care planning might come up in that question.
Yeah. Okay.
I don't know who was first. Oh, Margaret, I think is first.
It's actually Andrew this time. I've been listening to this session. Certainly in this area, which is West Somerset, we have a very high proportion of older people, and by extension, of course, a relatively high proportion of people living with dementia. I suspect that rural and coastal areas in general have higher proportions of older people because young people tend, as a wild generalization, tend to move towards towns where there is actually work. So there's as it were, an inbuilt bias towards those areas having a higher proportion of people living with dementia.
And fewer people to care for them.
And fewer people to care for them, and therefore an increase in either home deaths or care homes exist.
Thank you, Andrew. And that is one of the things that I'm percolating on with that finding of increased care home deaths in urban coastal areas. Is it because those areas in particular the younger generation are moving away from, and there isn't that informal care option to keep them at home or even facilitate a hospital death even. But yeah, it's just something that I'm still kind of thinking about and thinking through. So thank you. Georgina, do you have a question? Oh, I can't hear you. Do you want to pop it in the chat and maybe I can pick it up in there? Martin, did you have your hand up? I'm aware at time.
Very quickly, a couple of points. There'll be, I know I'm Scotland, so but ignore that bit. There'll be a couple of hotspots, if you like, where youth are in the coast, like Aberdeenshire for the oil. I presume Grimsby for the north, for the turbines and things like that. So there will be kind of youth hotspots. But my point was, being me, I got a half-hour appointment with my GP, actually, about all this. We couldn't believe it, half an hour. And I've asked to be left at home, and it flashes up, don't take me to A&E and things like that. So I won't know, but it'll be quite interesting to see what does happen with in the reality, because it's very plain what I want and clear. And
and hopefully you get what you want and it's well managed at home as well. That's what we hope, Martin. Hey. Thank you. East Sussex Coast, and there's others that you have discussed, high proportion of older people generally, plus former hotels. Yeah, interesting, isn't it? This kind of move away from the places that were traditionally quite touristy hotspots that are maybe no longer with international travel anymore. I'm okay to keep going, but I'm aware we're at time. Shall I just answer Emma's question, Martin?
We'll make Emma's the last question, unless
Yeah.
Georgina can.
Sorry, it wasn't a question. It was more a point of the rurality. And I know a problem that I faced was with my mum, who died in a care home, because it was very difficult to get home care. And they wouldn't come out to the village, so there wasn't the option of keeping her at home with carers because the care companies wouldn't come to her.
That's a good point. Yeah.
So I think that can be a problem as well.
Yeah. Yeah, that's a good point. And hopefully something that we'll pick up in the interviews that will come out.
Yeah.
Thank you. I'll hand back over to you, Martin, shall I?
Yeah. Sorry, Fraser. Anyone else got any questions for her? Either of them? No? It's been very interesting. Thank you.
Thank you.
Yeah. Thanks. And I'll see it all again tomorrow. But yeah.
Sorry, Martin. It'll be a bit different, but
No. Yeah. No, thank you very much. It was good and
thanks, everyone.
interesting.
Thank you.
Thanks.
Thank you.
Right. Cheers.
Thank
Bye.
you. That was so interesting.
Really interesting.